Hello, welcome to Independent Community TV. It is Thursday, December the 1st, 2022. My name is Jack Etkin. My guest in this segment is Alan Cassels. Alan is a drug policy researcher. He's written books on the subject. He's worked at and with universities and with various groups around the world on this topic of drug policy research. We're going to be talking about, is it time to rehire the fired healthcare workers in British Columbia and Canada and to apologize to them? So, Alan, what's the answer to that question?
Yeah, it actually, the problem actually goes beyond just healthcare workers, right? So a number of people in various professions, law enforcement, even the military, and certainly people in healthcare in British Columbia, were coerced by their employer to get vaccinated. Then some who refused for whatever reason. A lot of those people were terminated without any kind of compensation. Even so just thinking of this beyond just healthcare workers in British Columbia, I don't know if you know, Jack, I don't know if you've applied for a provincial government job lately, but you can't even apply for a provincial government job in BC unless you have proof of your COVID vaccines. So again, this what may have seen at the beginning as a fairly coercive policy is being maintained despite the science and really despite the history that we have now. And we've been through numerous variations on the original virus, and still these mandates apply. So speaking specifically though of healthcare workers, what seems to be gaining a lot of traction in the news these days is this sense of crisis in our hospitals. Things are overwhelmed, there's not enough staff. And so you have to ask yourself, are those staffing problems due to the fact that we've got maybe 2,000 or more healthcare workers? There's would be nurses, paramedics, other allied healthcare workers, maybe workers in long-term care, have basically been thrown out of their jobs. And it would seem to me that when it's a self-created crisis, if you've got problems in the healthcare system where you don't have enough people and you've laid off those people for what is now considered to be a pretty unjustified reason, it would seem to me perfect sense to be starting to go back to those people and say, look, we want to rehire you. I think there's a number of court cases underway where people are suing their employer for being unjustifiably fired for not being vaccinated. So there's those court cases ongoing as well.
But if those people are rehired, I don't know if you want to go here, but aren't they then endangering everybody by not being vaccinated? Because that's the argument that I assume that's the argument, that it's dangerous to have unvaccinated people walking amongst us.
That's clearly not true. I mean, the whole issue of the vaccine, even ability to prevent transmission, has always been a myth. There's been no science behind the vaccine protecting you from transmitting the virus to others. When you look closely at things such as the product monograph, i.e. the official product document of all of the COVID vaccines, none of them have been approved to prevent transmission. The vaccine simply does not do that. So to discriminate on the basis of whether you're vaccinated or not, because it's going to reduce transmission to other people, that's simply a non-scientific idea. And clearly, it's not just Alan Cassels' opinion. Scientists around the world agree with that. The vaccine does not prevent transmission. One of the senior officials in Pfizer also admitted that their vaccine does not prevent transmission. So that logic doesn't apply.
Seems totally bizarre.
Well, it's bizarre and it's kind of questionable. You sort of say to yourself, why would we continue if we've made a mistake? Why wouldn't we just maybe admit that we made a mistake? Let's let bygones be bygones and rehire these people. So that doesn't make sense to me on many levels, unless you want it to be punitive in some way.
And yet, as you just said, in the entire British Columbia public service and in a lot of the private sector as well, if you're not vaccinated, they won't even let you in the front door to apply for a job.
Yeah, which seems to me completely unscientific. It's coercive, and it's simply wrongheaded. Why this is being maintained is a real mystery to me.
What are the courts saying about this?
So, I mean, there's been a couple of cases. There's a big case in British Columbia where several government employees are suing the province for being basically unjustifiably terminated because of their vaccine status. There was one case that basically the judge, and it had to do with the union, and the judge looked at this and said, well, this is not really a jurisdiction for the court. This is a problem between the union and the employer, and basically wouldn't take that one on. There have been other court cases in the U.S., for example, where those mandates got overturned right away, including New York City, probably one of the wokest places in the U.S. have gotten rid of vaccine mandates for any city or government employee, realizing that the legal justification for it was simply non-existent.
Yeah.
So,
and many school boards here in BC had never imposed vaccine mandates.
mm-hmm. Yeah. So I mean, it seemed very well. I mean, I know people in the armed forces or in certain police, police association, police organizations. They also suffered the unjustifiably being.
It sounds like the courts really haven't ruled on this yet.
No, and I think that's what we're kind of waiting for. There have been some federal cases that I don't think were really well thought through or well applied, and some of those I think were thrown out. I mean, I think you have to look at it and ask yourself, is there scientific justification for having this policy in place? And if there is, the policy should be argued on the basis of science, not just what you believe versus what I believe. Is there good scientific justification for, a policy such as this? And I simply don't think there is. And I would love to hear from any of your viewers if they have good science to support why we should be maintaining this kind of discriminatory policy here in BC.
It's absolutely remarkable that here you are saying the science is not there to support any of this, yet we're constantly told the science is there, and these laws and rules have been put in place, thousands of people fired, based on, it seems from what you're saying, no science.
Yeah. I mean, that's exactly what I'm saying. I think that, like I say, jurisdictions around the world are also facing these issues, and there's no, as far as I can tell, no good scientific evidence to support discriminating on the basis of vaccine status for your employment. You might do it because you feel like it's important to, let's all play on the same team, but this it didn't apply to, say, physicians, physicians working in hospitals. Yes, the hospital might require a vaccine. If you didn't want to get vaccinated, you couldn't work in the hospital. Though physicians in their own practices, in their own clinics here in Victoria or other cities, there's no requirement for them to be vaccinated. Yeah. So the law or this discrimination seems to be piecemeal and affecting certain groups and not others. It just doesn't seem to be that fair to me.
Yes, I would agree with that. BC is fairly hard line in all of this, in firing so many people, the government of BC. So what should the province do?
Well, the last time we had a major firing, this was the health firing scandal that I was peripherally involved with back in 2012, where they fired 7 healthcare workers, one of whom committed suicide on these people were fired on allegations of data fraud and that kind of thing. Just this week, Jay Chalk, the ombudsman, came out and issued his final report to say that all the recommendations have been acted on. Those fired people have been very, very generously compensated. And I'm just wondering whether Jay Chalk is going to apply his ombudsman lens to what's currently happening with BC healthcare workers, because I would like to see that myself.
It's something we're probably not going to see for a while anyways.
We'll see.
Alan, any last words on this topic of, is it time to rehire fired healthcare workers and others and apologize to them?
Yeah, I mean, I think when these things get dealt with by the courts, that's probably when the science is going to come out, the good science. So we will be able to say, was it a scientifically justified action or not? And I would be very surprised if they could find any reasonably good evidence for firing people on the basis of their vaccine status.
Do you think this is ever going to be brought to the courts? I mean,
it's coming. It's coming, Jack.
Good.
Yeah.
Alan Cassels, thank you very much. And thanks everybody for watching this segment of Independent Community TV. Thanks, Alan. That was good.